Hey friends, welcome back to the channel and another video. In today's video, I want to share the 5 common reasons for low RVUs or low production. Now, before I start, I do want to mention that this is all relative, right? So what one provider might think are low RVUs, another provider might think that that particular number is quite right for them. So I'm not going to be mentioning any numbers just because I don't think it's necessary. So let's get into this video. So the first reason is lack of efficiency in your workday. I've mentioned this before. It is very important to establish a systematic approach to your workday in order to be efficient and productive. If you lack efficiency, then it will likely lead to difficulty being productive and thus lead to low RVU production. The second reason is not taking advantage of RVU generating opportunities. One of the core strategies that we teach in our RVU consulting program is you must learn to provide profitable services in order to improve RVU production. And in order to accomplish this, you have to be able to identify all or at least the majority of the available RVU generating opportunities in your workday and actually take advantage of those. But if you are unaware of these opportunities and miss out on them, then you're likely missing out on those potential RVUs as well. The third reason is poor billing and coding practices. Another core strategy that we dig deep into in our RVU consulting program is mastering billing and coding. This one you just cannot avoid if you're trying to maximize RVU production. The next reason is not preparing ahead of time for time away. This is one of those things that most people may not tell you about. As an RVU-based provider, anytime you're away and not seeing patients, you're not generating RVUs, point blank. So if you know that you're going to be on holiday for a week or so, or you're just going to be taking a week off to rest, you need to prepare ahead of time for this because otherwise your RVU production for that month is going to be low. You have to have a strategy in place which you plan to execute either before or after your time away in order to balance out your RVUs. Like I said, this is one of those things that most people may not tell you about if you ask them for advice on how to manage your RVUs. When I was working towards maximizing my productivity and my RVU production, let me tell you, I wanted to learn anything and everything I could, no matter how small. Now, in our program, I shared the exact strategy I used to prepare ahead of time for my time away. And as with all of the strategies that we teach, we tailor them to our client's specific workflow and vibe so that it ensures success. I always tell my clients, you may not need everything in the program. You might look at some of the strategies in the program and think that they're basic. Now, I think the basics are important because they're the foundation and hence why they're included in the program for that reason. You might look at some of the other strategies and think that they're a bit much. They require too much work, and that's fine. But there might be some strategies that you look at and think, I never thought about it that way. Or some strategies that you're already practicing, but maybe not doing them in the best way. So making those small tweaks can be a real game changer for your RVU production. So definitely check out the link to our RVU consulting program. The link will be in the description box if you want to learn more. The last common reason for low RVUs is not keeping track of your RVUs. If you think that your RVUs are low, but don't keep track of them or know what you're doing every single month that is leading to those low RVUs in order to devise a plan to change that, then you cannot expect your numbers to be any better moving forward. You have to know where you're starting from and where you want to be in terms of RVUs. So you need to establish a point A and a point B, and then come up with a plan to get you from point A to point B. And during that process, you have to keep track of what you're doing differently and how your RVUs are changing based on that. This is how you will ensure that you see that ramp up in your RVU production as you have hoped. Alright friends, I hope this video was interesting to you. If it was and you'd like to see more content like this, then definitely make sure to subscribe because I do post a video like this every single week, doing my best to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. If you're interested in joining our RVU consulting program, the link is below for you to check out. I've also included a link to a free training video if you have not already watched it. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.